Hi, this is Dr. David Tenner, and it is January 16th of 2018, and we're here with one of our patients, Mr. Harrison Parnell. And Harrison came to see us originally in February of 2017, so it's been almost a year. He started on a program in April of 2017, and Harrison has done quite well under our care, and he's going to share a little bit about his experience with us here at the clinic. So Harrison, I'm going to turn the floor over to you.
Okay.
Tell us a little bit about your history and what brought you in originally.
So I've had psoriasis since I was in high school. It was just something minor in my scalp that I would scratch and get the flicks in my shoulders. I would see dermatologists. They would give me creams and ointments and shampoos. Nothing really worked. Eventually, probably around a year later, they gave me Solera. I just kept getting the shot taken over and over again, and finally I couldn't afford it anymore, and so I just had to deal with psoriasis, and within about 6 months of not taking a shot, my psoriasis flared up like I had never seen before, with patches all over my body, just red scaly patches. I could grow a new set of patches and scales every day because it was so bad. And then I had a friend that referred me to your office.
Okay, so Harrison was suffering from psoriasis, which is an autoimmune skin condition, and oftentimes with these types of problems, patients will see medical doctors who will put them on various drugs to suppress symptoms, and while it may be effective in doing that for a time, the drugs themselves, of course, are toxic, can put you at risk for side effects, and over time they tend to stop working in terms of just the symptom suppression. The patient's not actually getting healthy, the causes of their problems are not being addressed, rather the drugs are just suppressing symptoms that are occurring. So Harrison came in to see us, and we did a full workup, case history, physical exam, lab work, and then hit the ground running with him last April. We put Harrison on a fairly intensive detoxification program and a rest period to really tear down some of the old tissues in his body. And that's really what we do. We don't treat symptoms, but rather take what we call, and Dr. Goldberg has coined a biohygienic approach, where rather than put new materials into the body on top of old materials, the focus is to tear down old tissues and then rebuild them, so the person essentially gets a new body, including new skin, over time. And Harrison, you saw some improvements pretty quickly, pretty early on, so
yes.
Tell our audience a little bit about the changes that you saw physically in your condition after the first few months.
So within a week or so, I stopped growing scales. I stopped shedding scales all the time, and then within the first 30 days, I'd gotten a tan. You could still see kind of, not necessarily scar tissue or anything like that, but you could still see pale spots of where it was. And obviously no more scales or red patches. It was just light pink. And then within, I would say, 2 or 3 months, the majority of it was gone. And now my skin is nearly clear.
Yeah, it's amazing compared to where Harrison came from initially in terms of what he looked like, and he looks a world better. I'd say we've got a 90% or so clearance so far. Harrison has had a long history, about 8 years, and we still have some work to do, but there's been massive improvement. Are you taking any drugs?
None whatsoever.
No. Do we wave any prisms or potions or
Not at all.
Spooky with you? No.
No,
It's
no.
just some hard work on it. So Harrison, we appreciate you sharing your story with us, and Harrison's worked really hard. He's earned every bit of improvement that he's made here at the clinic. And again, thank you for sharing.
Thank you.